So, good afternoon. I'm Emma Griffiths. I'm the Director of Advocacy and Communications for the Queensland Alliance for Mental Health. I'm your facilitator this afternoon. And I'd like to welcome you to the Community Mental Health and Wellbeing Sector Jobs and Skills Summit. We were beautifully welcomed to country this morning by Joseph from New Knuckle Yagara. And I would now like to acknowledge the Yagara and Turrbal peoples, traditional owners of these lands on which the State Library stands, and also acknowledge traditional owners of the lands throughout Queensland and Australia from which you might be watching this event via the live stream. We also recognise the courage of people with lived experience in our sector and the crucial role they play now and will play in a vibrant, skilled workforce of the future. We would like your questions this afternoon, and you can submit them through Mentimeter. The QR code is on the screen, or if you're watching on the live stream, you would have received that QR code in an email yesterday. If you are accessing Mentimeter through the app, you need the code, which is 2725714. 2725714. So I hope to see plenty of questions there from you. If you're in the audience, that is also the way for you to submit questions throughout this afternoon to the panel, to the presenters, to the Alliance in general. You've also been given, and if you're on the live stream via an email, a Jobs and Skills Summit workbook. So inside it has details of QAMH projects that are relevant to this. It has contacts for you within the Alliance, and it has room for you to take notes as we talk through. Now, so within that workbook, there's room for you to make notes, and we're hoping that over the next 12 months, this acts as a bit of a memory jogger for you to come back and continue to contribute to our work on this, because we will have future conversations about it. Now, I'd like to introduce our expert panel for you this afternoon, who will be chipping in with their wisdom in amongst the presenters that we have this afternoon. So Queensland Mental Health Commissioner Ivan Frkovic. And Ivan has been Mental Health Commissioner in Queensland for the past 5.5 years. He brings more than 20 years' experience in the state's mental health system to that position, and as Commissioner has most recently been fighting for better mental health care for Queenslanders through very regular consultation with the State Parliamentary Mental Health Select Committee inquiry. Viv Kissane is on our panel today, and Viv is co-founder and CEO of Peachtree Perinatal Wellness. Viv is a champion of the lived experience workforce, using her own lived experience and recruiting, training and supporting lived experience workers. Viv's taken Peachtree from a volunteer organisation to what's a flourishing community mental health service now. And last year, Viv was awarded an Order of Australia medal for her service to the sector, and not everybody has one of those. That's pretty cool. Well done, Viv. David Bradford leads training and education consultancy, the Devand Group, here in Brisbane. David has been a TAFE teacher, a university course coordinator and lecturer. He's held several national roles in workforce development. Last year, David and his team, in partnership with Alambicare, won the New South Wales Training Award for Industry Collaboration for developing a program that put 65 staff through a work-integrated bachelor's degree and 229 through a work-integrated Diploma of Community Services. And I've just discovered this morning is also a father of 6 children. So, yeah, I know. David, not everybody has that. Thank you very much, Viv. She's funny too. That's brilliant. So that's your expert panel for today. And now to launch the summit properly, the CEO of the Queensland Alliance for Mental Health, Jennifer Black.
Thank you, and I won't speak for too long, but there are a couple of things I want to reflect on. So when we saw the new federal government was holding a Jobs and Skills Summit in September, hope bloomed. Maybe, we thought, this federal government will fix something for our sector. But the summit came and went, and hope went with it. We decided it's like a lot of things. If you want something done properly, you have to do it yourself. So here we are at our own Jobs and Skills Summit. It's not 2 days of talks, it's more like 2 hours. But this, we hope, will be the start of a process. Today we're looking at, reflecting on some ideas, looking for ways forward, solutions even, to the staffing and skills challenges holding our sector back. Wouldn't it be good if there was a clear pathway for school leavers for mid-career changes, with contemporary training, skill development for career progression, and enough skilled people to do the work we're asked to do right across Queensland and in local communities? So how do we get there? Well, we haven't totally given up on winning support from the federal government, but happily we've had a little bit more success with the Queensland government, who we're working with to create a workforce strategy for our sector. Today is an invitation to the sector to work with us on that strategy. So first up, I'd like to introduce Sarah Childs, our Director of Sector Engagement and Development, to talk about the process and where to from here. Thank you.
Got to be careful not to trip over on this stage, don't you? So, hello everyone, and yes, this is a new project, new presentation for me, which is very exciting, but it means I will need my notes to refer to. I just thought I'd find out where Sally was up there. So Sally, wave your hand. So I'm just thinking later on if there's curly questions. Sally's been a big part of this project to date, so she can help me answer some of those. Thanks, Sally. All right. Oh.
Is it working for you? No.
Oh, that's
the green one.
Sorry, I was sitting that one, not that one. Apologies. So as Queensland faces one of the tightest labour markets in history, service providers are struggling to fill workforce gaps. We've heard it all throughout the year. It's the biggest challenge that our members are facing. Workforce issues go well beyond attraction and retention of workers. The issues are complex and multifaceted and include the need to strengthen skills and capabilities, improve conditions so staff feel safe, supported and valued, ensure employment stability, encourage workforce diversity and enhance career pathways. So whilst you'll hear about some brilliant improvement capacity projects that we've tackled at QAMH this year, including the peer mentoring project that Amanda and the team are going to talk about later, and the Micro-credential that we developed in partnership with TAFE Queensland, we believe that a coordinated and strategic approach is required to achieve the changes needed. So, ta-da! So to this end, we've actually been talking with the Mental Health, Alcohol and Other Drugs branch to discuss the development of a community mental health workforce strategy and accompanying action plan. And we're excited to announce that this concept has been supported. And today is about launching this new project and launching the first key milestone in the project, which is the draft issues paper. So we know at a statewide level, the Queensland Government has committed to focus workforce planning under Better Care Together. So improving workforce capability and sustainability has been highlighted as one of the government's 6 key priorities in this document. And we're hopeful that this piece of work We'll make sure that the needs of the community mental health workforce are considered alongside and as an equal to the rest of the sector. As seen on the slide, our work will include researching best practice, both nationally and internationally, reviewing key sector skills required to deliver evidence-based services for the future, mapping and evaluation of current education and career pathways, and consultation across the state. We're going to be setting up a project advisory committee in the next few months to support the project delivery, and that will include many people here in the audience and online today. So some key project dates that you might be interested in. Today, the 18th of November, is the first key milestone, as I said, where we're launching the draft issues paper. We'll get feedback on that and hope to finalise that by the end of February, where we'll start our statewide consultation on the strategy, which should be finalised by the end of next year. So all throughout next year, this will be a key focus piece for the Queensland Alliance. Should have had another drum roll. That's why they put the video, the sound in, so I didn't go. Anyway, launching. No, not that silly. So launching the draft issues paper today. The issues paper has been informed by evidence put forward in a number of inquiries, reports and reviews, and most notably the Productivity Commission's Mental Health Inquiry Report and the Parliamentary Inquiry into the opportunities to improve mental health outcomes for Queenslanders. It's orientated around three pillars to guide the design and delivery of workforce reform. It's expected the workforce strategy and accompanying action plan will also align with these three pillars. So if you go to your workbook on page 5, that will take you to the key pillars that we've focused the workforce issues around. And it will also, on page 5, gives you the QR code that you can scan, and will take you to the full issues paper that's up on our website today. So pillar 1, qualifications and training. We'll look at qualification development, core qualifications, so standardising foundational knowledge and skills, and then leadership qualifications and skills as well. So looking at career progression and specific sector-specific leadership skills required. We'll look at student placement, so securing them from a student's perspective and supporting them also from a workplace perspective, professional development, so access to opportunities to develop for all classification levels, diverse population, so our capability to meet the needs of people from Aboriginal and Torres Strait Islander descent and people from multicultural backgrounds and the LGBTIQ plus community. Specific issues related to the qualifications and training for peer workers and organisational readiness in organisations who employ them as well. It will be a big part of Pillar 1. Pillar 2, attraction and retention. We'll look briefly at increased supply, so looking at the poor recognition of the sector and lack of recognised entry pathways, and competition also with the clinical government workforce. Specific issues associated with working in rural and remote locations and a lack of incentives available to our workforce will be are discussed, as well as lower remuneration, NDIS casualisation, short-term contracts, plus limited career advancement opportunities impacting on staff retention. Just a few small words there that have such huge issues surrounding them. Our staff are stressed. So really we want to also look at workforce wellbeing. Their stress as a result of vacancies, increased demand, inadequate training and supervision, and experiences of vicarious trauma, and we know that. Am I on time, Emma? Yeah, cool bananas.
Great.
So the last pillar is the system enablers. So a lack of overarching governance, workforce planning and development for the community, a culture, sort of our sector being undervalued, and people, others having low expectations of our abilities is also discussed in the issues paper, as well as, I was going to say, lack of funding, lack of data, lack of evidence based practice or pockets of excellence, and culture, as I said. So if you have a look at the document, we've also included possible solutions in there, and this is just to start the thinking, to start the conversation, and to commence the strategy discussions. We'll also have separated solutions and recommendations to government out in the paper also. So as you can see, some of the solutions within the document include traineeships, development of more micro-credentials, developing new qualifications, raising awareness of our sector is actually a career of choice, because we do know that lots of people simply fall into this sector, sort of don't leave school with, oh, I want to work in the community mental health sector. And then programs to promote workforce wellbeing and address burnout. So how to make a submission, that is also at the end of the issues paper. So we're asking for email submissions. We also might create some opportunities, some focus groups, also to make it easier for people to give us some feedback. We've tailored some questions for you to think about when providing your feedback, and they include asking you whether you agree with the definition of the community mental health and wellbeing workforce that's included in the document, whether we've captured the issues correctly, what's most important issues in your organisation at the moment, and also some reference to whether you agree with the solutions that we've proposed also. So you're welcome to actually use those questions, those guiding questions, or not, and give us totally different feedback. So you have until the end of January to provide that feedback. Go to the website, have a look at the issues paper, and we look forward to hearing from you.
Thanks, Sarah. Just hang around just for a few minutes. Yeah. So we need questions from you and comments, suggestions, the Mentimeter code 2725714. And I mean, as you can see from Sarah, it's going to be a huge project for the Alliance. And within the workbook there's a QR code that you can use to go, it'll take you straight to where the draft issues paper is on our website. And that's where you'll find those possible solutions, those suggestions. And that's really what you need to read to see where we're going with this and to tell us whether that's the right direction or we need to swerve left or right. And our Project and Policy Officer, Sally McLeod, will be leading that project, really, with Sarah. Is incredibly passionate about this and wants to get it right, I'm sure, don't you, Sally? So there are lots and lots of issues there. And I just wonder now if I could ask our team of wise people here on the panel what your first impressions are, what your thoughts are about where we're going with this. Perhaps I could start with you, Mr. Commissioner Ivan Frkovic.
Thank you for letting me go first.
Yeah, I'm just going to adjust your microphone.
Thank
there.
you for letting me go first. Look, I think the approach, and I haven't read the issues paper, so I'll certainly look at that. But certainly those three pillars make sense. And there's a lot of work under each of these, which I think clearly needs to be unpacked. But for me, one that sort of sits, and having come from the sector, is if you think about funding as an enabler, it cuts across all of those. If you as an organisation don't get funded sort of adequately for your overheads, how can you provide professional development and support? If you get short-term funding, how can you attract people or retain people who are going to leave before there is some stuff that cuts across all of this, which will certainly help, but they're the sorts of things that we need to have discussions at that more systemic level. And the other one that I said this morning, which I think there is still some work to be done, which cuts across all of this, is about being clear around which sectors and what workforces do what. Because otherwise there seems to be this sort of, are certain functions and supports, whatever, and yes, people should have a choice, there's no doubt, but is there something around being much more clear around, who does what, which might actually help us to attract the right workforce into the right sectors to get the right outcomes. So I think they're some of the things that I would only suggest from first impression.
David Bradford, with your experience in training and education and also kind of managing government department funding, what are your initial thoughts about the approach there?
Oh, look, I think, I agree with Ivan. I think you've absolutely, hit some very sensible spaces. I think that some of, and I think hit things that you can do something about. There are things in the economy we can't do anything about. It's not a skill shortage anymore. That horse is bolted. It's a warm body shortage. And when we think about the reality of, when I left school in 1990, about 200,000, maybe 230,000 graduates. This year it'll be 50,000. Last year it was 51,706. In 1992, we had our highest rate of Year 12 completion, and that was 77%. Last year it was 56%. And that's all happened, I think, over a couple of decades where there's been a significant demographic shift. And that has, I think, at times kind of been missed by, and I'm thinking the broader health and community services sector and perhaps government to some extent, insofar as we're still trying to meet the future with what we've done in the past. And there's some things here that really encourage me. The leadership development training. How many of us working in the sector went from being clinician or practitioner into a leadership role with no training? One day you showed up at work and the person you were reporting to was no longer there. You were given authority, and now your job was to help others achieve practice depth when you may not have had enough time to have achieved it yourself. And with no managerial training or acumen, keeping the people who keep the people is going to be part of what we need to do going forward, because we'll have to be able to retain people, and I can see that really strongly there. And I'm very, very interested in micro-credentials and qualifications in terms of, there are qualifications that were designed on the basis of 77% high school completion, on the basis of 200,000 graduates every year, on the basis of 10 people lined up down the block to apply the jobs. And a lot of qualifications have barriers in them to completing them. If you say to somebody in today's economy, I want you to take 2 years to finish a qualification, and I want you to do a 200, 300, 400-hour placement for free, they're going to go and do another qualification. You know what I mean? We've got to be a bit realistic about barriers in qualification. So I think this is absolutely on the right track. There's a lot there to it's ambitious. There's a lot there to do some good stuff with.
I hope that wasn't like, yes, Minister, this is very courageous of you, ambitious. So, oh.
Yes, not at all. Not at all.
No, okay, thank you very much. Was that Humphrey? Yeah, no. Thank you very much. And Viv, with your experience and with lived experience, at the centre of really what you do and what you've seen through our sector, what do you take away from this so far?
Look, I'm really supportive. I think this is a really important piece of work that needs to be done, particularly coming off the back of the launch of the National Mental Health Workforce Strategy. So I think definitely bringing it back to Queensland. We've got specific issues across our state and the populations across our state, which does need particular consideration. So I think it's going to be a really worthwhile piece of work. which hopefully ultimately is going to benefit the people who we're working with and are engaging in services, because that's the ultimate goal, right? This is about helping people and how we do that. I think this is optimistically
Ambitious, optimistic, oh dear.
ambitious. I think it's all really important, and I really hope that something really meaningful and juicy will come out of this. But if I'm thinking even just from a lived experience workforce perspective, and I know you've got it specifically listed there under Pillar 1, but like Ivan was saying, like this actually goes across just with the lived experience lens. All of these issues are going to need to be delved in just from that perspective. So I think it is going to be a lot of work. I think you're going to need to make sure that you have a really solid lived experience advisory group or council or something that's going to help you kind of meet the outcomes that you need. But look, like I said, really supportive of the work being done.
The only thing that I would add is what seems to be missing, at least from my perspective, is that pipeline. I'm talking about the pipeline between, finishing, graduating school into TAFE, into undergraduate degrees. That pipeline is really important, and we've certainly had some experience in Queensland, but also the pipeline between, even tertiary qualification into the sector. I think they're the bits that are really important, because if you get some of those pipelines right, or bridges to help people come across, I think we've seen in the past that we can actually do much better to attract people into an area, which I can tell you, if I use the words more broadly, is not a sexy area. Come and work in mental health, child and youth mental health, but come and work in the adults or in inpatient services, or etc. How do we make it attractive, but also support students in that pipeline to actually come across into mental health? And we've done some stuff in the past which I think we can learn from, but we do things and they work and then we just sort of pack them away because there's no recurrent funding.
So how do we stop that happening?
Funding, thinking about the funding that we put into this and sort of making sure that we've got the support for a longer period of time for this, particularly in the current climate, as you say. It's not so much even about people with qualifications, it's about getting warm bodies into seats at the moment is what we're struggling with.
We've got a couple of questions coming in on Mentimeter, so thank you very much for those. Now, I think, Sarah, this one would be for you. How do you see this work intersecting with the National Mental Health Workforce Strategy and the Queensland Mental Health Workforce Strategy? How does it intersect, Sarah? Do we need drum roll?
It definitely intersects with the Better Care Together work because we're working in partnership with the mental health branch, and this will be a parcel of work that is done as part of that priority. Is that correct, Sandra, in the back there? Thank you. So definitely sort of influencing state there. Nationally, we haven't seen the National Workforce Strategy yet, so we'll wait and see. No, we've seen a bit of an embargo.
We will hear the Commonwealth talk about it next Friday.
Yeah, there you go. So absolutely, we need to make sure that we're working not at odds with the national strategy.
Yes, and that's been very deliberate right from the beginning of thinking about this, hasn't it? So another question, should there be a fourth pillar, lived experience in the workforce, which is about supporting people with lived experience into work, any work, not just in the mental health sector? Perhaps I could ask you, Viv, should there be a fourth pillar, lived experience in the workforce?
Look, I think it's always good to create as much attention around the workforce as we can, but I actually think, my initial reaction is that lived experience just needs to be weaved through all of it, and it needs to be visible through all of it and have a major focus on it. So I think it's perhaps not an extra pillar, maybe it's a little umbrella that's kind of catching all of it.
a consideration with each of the issues and each of the strategy.
And
Sections of the strategy.
yes, and that suggestion as well from Viv earlier about a lived experience advisory group. Funding, and so this is another question from Mentimeter. Funding and expense for external professional development is a current challenge to navigate. So this goes to one of the points there on the plan, professional development. It's been identified as a problem for the workforce, but how do you fund it? How do you pay for it? How are you going to look at that? You've got possible solutions already, haven't you? It's a click of the finger. It does come down to funding again, Ivan.
I'll come to that, but just the earlier point, if I can say, there is lots of opportunities through the state government, Skilling Queensland and back to work stuff that we should look at. How do we support those programs to have a strong focus on lived experience to be able to build up that workforce? I think in that earlier point, I think there is things that, can I say that generally we in the sector don't take advantage of well enough to be able to do that. The state government is probably the only state government that invests in employment, because it's usually seen as a Commonwealth responsibility, but employment readiness stuff is what the state does really well. How do we as a sector tap into that for lived experience, but generally for our workforce that we may need? That's the first point. Around the funding, if I can just say, this is an ongoing challenge between, when you get a grant, and my colleagues are here from health and others from, PHNs, it's about the percentage of funds that you get for what we call overheads. So, and everybody from a funding commissioning game tries to reduce that percentage of money they give you for overheads. Having been in the sector for 5 years and grappling with this, but for example, the organisation I was with, they struggled because we were a national organisation to work with less than, say, 20% overheads. 20% overheads, while an organisation that might be based at New Farm and working in that area might be okay between 10 and 12%. But it's about within that and how much you get. Can you carve off funds to provide professional development and supervision and ongoing sort of support to your staff? So unless the funding really thinks about that and considers that, rather than tries to bring you down in terms of every submission that I remember putting in was about, that's a bit high, 18%, or that's a bit high. But there was no thought about the need to invest in your staff to be able to provide those things.
David, have you seen professional development done well?
I have, and I'd endorse Ivan's remarks about Queensland Government in terms of the High Level Skills Fund and those sorts of things, leveraging off of existing funds in order to be able to actually train up your workforce. And I suppose if I could come back to a point that I was sort of really leapt out to me when Viv spoke, I was thinking about weaponising is not the right expression, but sort of utilising a volunteer workforce. We've seen good things happen where sectors have been able to actually use their volunteer workforce as a pathway, as a way into the sector. That people might come in as a volunteer, they may get a micro-credential like you're proposing here with TAFE, or they might get some professional development training, and that could turn into stronger accredited training that might lead to a employment outcome. My work has been principally in the child protection space, and we would have 400 foster carers leave every year. And the amount of training we'd done with foster carers over time, and then you lose them out the back door. If you could turn them into staff, and there's a way to do it, and it's the higher level skills, it's the state government sort of investment in training and development in that vet space. I think that where it's done well in a leveraged way. No agency has an embarrassment of riches that could cause them to go out and actually attract all of the training they'd need in order to build their entire workforce. But united, you can actually put some funds together and say, well, look, we all have a common issue here. We have a common need for this. Let's actually, play together and bring funds together, but also let's leverage off of what's happening or what's available elsewhere out there. And I guess the point I'd make about the lived experience piece in terms of weaving that through. I've been in the sector for 32 years, and I've been in the training space for 20 of those. And not all training providers are created equal. And so some have really good branding, and they even have funding, but what they have is off-the-shelf stuff. So if an RTO approaches you and says, "Oh, we want to train your staff, we want to do this," remember these words: training and assessment strategy. They have to develop one, and they have to prove that they've consulted with industry. And most of them don't. What they do is they get a letter and they put it on their thing to sort of skate past it. You can actually say, well, your training and assessment strategy needs to demonstrate how you've integrated into this training package, how you contextualise this training package to actually meet the needs of this workforce. And you can be bold and bolshy when talking to an RTO about that, and making sure that it actually meets your needs. So I'd say leverage the available funds out there in terms of programs like Skilling Queeners for Work and high-level skills. And when you're talking to RTOs, be a consumer, be demanding about what they do. And they can work with you. You can do work-integrated learning. You can use internal experts to actually deliver some of that and still arrive at an accredited outcome. Don't be sort of thinking you have to show up with your hat in your hand when speaking to those folk.
Very good to hear, David. You've got inside information on that too, don't you? You know, full disclosure. Now,
Can I just say as well, we're really happy today to have our DESBT colleagues here. It's really exciting. We've been picking the brains of our industry skill advisors, Vicky and Jamie. So we really are trying to tap into resources that are available that we probably didn't know were available in the mental health community sector. So looking forward to working with you guys.
Great. Thank you. Thanks, Sarah. You happy?
Happy.
So a lot of work there to do. It's ambitious. It's optimistic. We hope to deliver. And we can hopefully call on all of you to help us craft that. So you've got until, is it the end of January, around the end of January, to put in a submission to the process, and then we'll have our final issues paper to then continue the work. And yes, we will hear shortly from the Department of Employment, Small Business and Training on how we as a sector can utilise, weaponise the overarching Queensland workforce strategy, so that we can, take advantage of what's actually out there. If you haven't asked a question yet on Mentimeter, have a think about it and post one. I'm the only one that's going to see them. I can't guarantee every one of them will be asked. Is there a problem with a Mentimeter? No? Oh, the code. I can give it to you. 2725714. That number again. 2725714. And, it's completely painless putting a question up there, really. We're not even asking you to stand up and ask. So hopefully we've got some brain juices flowing with questions, discussions, and we've already heard today a couple of mentions of the national workforce strategy for mental health. We have managed since the federal election to actually meet with the Assistant Mental Health Minister, the federal, Emma McBride, and we invited her along today, and she's turned up in video form. She's pre-recorded something for us in her Parliament House office. And if I could ask Chris to get us there, we'll hear from the Assistant Minister now.
Hi, I'm Emma McBride, Assistant Minister for Mental Health and Suicide Prevention and Assistant Minister for Rural and Regional Health. I'd like to begin by acknowledging the traditional owners of the land on which we meet. As I'm recording this in Canberra, I'd like to acknowledge the Ngunnawal people. I extend that respect to all First Nations people who are here with us today and pay my respects to Elders past, present and emerging. In doing so, I recognise the stark disparity in health outcomes faced by First Nations people, especially in remote communities, which is why I'm proud to be part of a government that's committed to implementing the Uluru Statement from the Heart in full. Voice, treaty and truth. I'd also like to thank the Queensland Alliance of Mental Health, in particular your CEO Jennifer Black, for the opportunity to speak at today's Jobs and Skills Summit. We're here today to discuss a significant issue in the mental health and care sector, and that is workforce. The Albanese government held its Jobs and Skills Summit in September, and we're listening widely to health professionals, carers, service providers, and people with lived and living experience to address this challenge. We're also investing $11.7 million to fund 15 new advanced skills training posts for rural GPs and rural generalists, including further training in mental health. This will help us improve mental health care and support services outside of big cities. As a mental health pharmacist, I understand the importance of having a strong workforce to support patients, their families and carers right across Australia. The Albanese government is determined to work across all levels of government to build a mental health and suicide prevention workforce that is culturally safe and appropriate, and one that responds to the changing needs of communities across Australia. The 10-year National Mental Health Workforce Strategy is close to being finalised, and we've agreed to take immediate action on critical shortages for 6 priority professions, including psychiatry, psychology, mental health nursing, First Nations mental health and suicide prevention workers, lived experience workforce, and other allied health professions. People with lived and living experience, their families and carers, play a key role in improving our mental health and suicide prevention services. I'd like to acknowledge the contributions they've made and continue to make to improve mental health care in Australia. The Albanese government is providing up to 390 training scholarships for people with a lived and living experience of mental ill health to promote career pathways for them in a sector they know well. We're also working closely with the Brisbane North Primary Health Network to support the operations of the National PHN Mental Health Lived Experience Engagement Network, which promotes peer workforce development. We know that ongoing learning helps support the mental health workforce to deliver quality care. That's why we're funding tailored mental health supports for health workers to make sure they can get the care and support they need, including the Black Dog Institute's The Essential Network, which offers support and mental health advice for healthcare workers, and Doctors for Doctors, which promotes the health and wellbeing of doctors and medical students across Australia. It's our hope that we can continue to strengthen the mental health and suicide prevention sector by enhancing the mental health workforce and supporting people with lived and living experience to be part of leadership and decision making. I'd like to finish by thanking you for everything you do in delivering care and support to people across Queensland who are struggling with their mental health and wellbeing. I look forward to hearing the outcome of today's Jobs and Skills Summit. Thank you and congratulations.
Okay, well, we can't ask questions directly of Emma McBride. We can tell her she's going to hear more about this summit, that's for sure, isn't she, Jennifer? Yeah. She absolutely is. And Jennifer and I met with her, and I think we felt like she heard main points. And one of the main points Jennifer made during that meeting was that, very good to be supporting those main professions that work in the mental health sector, but it doesn't quite fit the bill for our sector, does it? So, yes, and then, they had a Jobs and Skills Summit for 2 days in Canberra, and we're pretty sure they didn't use the words mental health once, right? And we looked at the guest list as well, and there was nobody there whose specific role...
I think the National Mental Health Commission was there from understanding from a mental health perspective.
Okay.
That's my recollection.
Okay, well, Ivan can stand on the record there. You've defended them. It's good.
I'm not defending anybody. I'm just
Anyway, we were miffed. So here we are. We've got our own Jobs and Skills Sector Workplace Summit. Viv, when you heard the Minister there and she's talking about the National Workforce Strategy, heard from Ivan that it's probably going to be released next Friday.
They're going to talk about it next Friday, definitely.
They're going to talk about it next Friday. Have you got any hopes, concerns already?
I believe I would have both of those. I am hopeful that lived experience workforce is clearly going to be identified, and there's going to be some specific strategies to deal with the uniqueness of that workforce. But at the same time, expecting to be disappointed.
Oh, dear.
Which I'm trying to be glass half full, but I think it's the issues around our workforce are so complex, and there are so many of them that I think it's going to take quite a large strategy and a huge piece of work and lots of funding to get around those issues.
Mm.
But this is a good start. We've got to start somewhere, right?
We do have to start somewhere. Yep. At least they're talking about it.
Yep.
Yeah.
Yeah, absolutely. At least, we're in there now. It's I think a workforce that's clearly been identified through, all of the reform that's been happening over the last couple of years. It's clearly been identified that it's valued and needed to be able to do the transformative work that we want to see in this sector. So I think now we're here and we just need to see some action around it.
David, hopes and concerns about workplace or workforce strategy coming from on high, from federal government level and trickling down?
Sure. I was enthused to hear the lived experience workforce mentioned, because I haven't heard that a lot in times past. I think one of the hopes I would have is that there's some broader strategic thinking or structural thinking around the things that affect workforce. So we don't always sort of immediately sort of stop to think about it, but we think about high casualisation as an issue across the sector and across our workforce. And the attractiveness of the job is potentially less attractive if your way to it is via many years as a casual. One of the reasons for casualisation is short contracts. If you make the contracts longer, so we've had this big push for traineeships. Traineeships run for a certain length of time, and it's hard for us as a sector to actually give traineeships if we've got short contracts. If we've got contracts that are 12 months to 12 months to 12 months, or extending that way. You look at workforces that have 8-year contracts. So if you go to the airports and look at a lot of the cleaning contracts, they're 8 years. If you look at that workforce, they're not casuals, they're permanents. And people come, they stay, they clean, they participate in the economy, they take out loans, they buy houses, they improve their situation and their circumstances, and because of one key thing, the length of the contract. So I would hope that from a federal level, there's a good look-see at what's actually, what are some of those strategic things that we can actually fix that have a significant downstream flow. And they are things like the length of the contract you offer agencies. They are things like how we actually support support industry sectors that can automate to do so. So for those of you who hate going to Coles and putting the stuff through yourself, I guess the benefit of that is that frees up labour supply for workforces that can't put people in front of a robot or put people in front of a machine. Then maybe that's not a bad thing. So, and only the federal government can kind of drive that. So I would like to think that in the workforce discussion, there's some zooming out and a good look-see at what we do, because again, a lot of what we're dealing with are the structures that we've set up for a different time, for a different demographic, for a time when there were plenty of uni students going to the lecture at 2:00 on a Thursday, working at Subway and happy to have a casual job or a volunteer role. Yeah.
Earlier, you were talking about a shortage of warm bodies generally, and that is obviously going to be like all the sectors that we hear about that are short of people. The other day I was listening to the fact that there's a real shortage of welders in Australia. So it's all the way from the trades and it is into the professions as well. So what, do we need a federal government to be sort of doing the Costello trick of have a baby for the mum, a baby for the other parent and a baby for the country?
And in 20 years it might help.
Okay, everybody of childbearing age, if you could please think about that, Sarah, if you can just put that into the strategy, that'd be great.
And I think we've already established this morning that I'm doing my part.
Definitely are. And do any of them want to work in the mental health sector, do you reckon, David?
I'm proud to say I have 2 disability support workers, so, we're
wow,
heading in the right direction, aren't we?
Yeah. Okay, I've got a question that's come in through Mentimeter, so thank you very much for that. The disparity between clinical mental health professional and LEX, lived experience roles within workplace strategy, integration and support is well acknowledged. What's being done to ensure these roles work together with mutual respect and consideration? So, disparity between clinical and lived experience, and encouraging them to work together with mutual respect. Takers?
Yeah, well,
Viv.
I think historically, and And very generally, I can say that the lived experience in the peer workforce has probably been taken advantage of, and we've not been given the pay rates and the awards and everything that rightfully we should have, and that's probably contributed to that power imbalance and that financial imbalance. I think the work that's been doing over the last few years, definitely there's been movement made in the direction about properly remunerating people with lived experience for their participation and bringing their expertise into the services. So, but I think there still is some work to be done around looking about what awards we get paid under, that type of thing. What was the second part of the question?
That's answered it basically. How to get if you go to those, if you talk about them being at extremes, the clinical and the lived experience, then how do you make sure that they're working together?
Yeah, I think that comes
collaboratively and with respect.
I think there's a lot of cultural work to be done there at an organisational level as well, so that the workplace is set up and culturally appropriate, that everybody understands the roles and what lived experience workers are there to do, and have that mutual respect between the whole team and from management, and therefore everyone's on the same page and working more collaboratively.
There's been another comment about that as well, addressing awards and pay scale. So peer workers feel valued when they work alongside case workers. So that's obviously, going to have to be a big part of the work that we're doing. David?
Yeah, I think there's 2 points for me there. One is I'm banging the drum about work integrated learning, that when people come in, whatever place they come into our orbit, linking them to a work integrated learning opportunity where they have the opportunity to grow, develop qualifications, be recognised, so have recognition of prior learning structures that are robust, that are appropriate, but also have connection to a qualifications profile or pathway that helps people actually use their time and experience to gain qualifications and move up through the Australian qualifications framework from Cert 3 to Cert 4 to diploma, etc., and relationships with universities. And that's the structural answer. The second answer is a bit more cultural. One of the points of conflict for our workforces is between those who have the lived experience and have expertise as a result of living with the conditions, and those who have been trained and went through university preparation and perhaps developed expertise that way. And if we talk about I'm the expert, what I'm really saying is I understand. And the culture we need is I don't come with understanding. That understanding is the product. It's the result of our collaboration. It's the result of working together. We come to understand what's happening and therefore can be effective in intervening or supporting people. We've had a significant intensification of the work we do. We talk about the complexities of it, but when those complexities start to actually bang into each other and intensify each other, when we have comorbidity and we have all these sort of issues where you're sort of thinking, where do I even start? Understanding probably should be the destination, and that idea of coming with expertise, it's about contributing that. I lectured at QT for 6 years, and one of the things that was a little concerning for me at one point in time is that students were leaving a 3-year bachelor's degree being told they were experts, and that there's a few prices to pay if we do that. One is humility, the essential humility that actually gives you the human skills to be able to connect with somebody on the worst day of their lives is lost when you approach it, I'm the expert. I think that's a problem. I think also it actually potentially gives that person a message that they don't need to continue to learn. And I think that there's a critical humility to that as well, in terms of being able to developing a capacity to benefit from the things we do with practitioners in the workplace to develop practice depth and develop their learning. So when I think about that cultural space, if I could, and it would have the same thing in child protection. We'd have foster parents across the table from a traumatised young person at the breakfast table having a conversation, the young person expressing their needs or wants or desires to a carer who came into an uneven fight with child safety officers and, were accused of having bias or, well, yes, they have bias. This person lives in their home, and they care about them deeply and they're trying to be their advocate. Surely understanding is the destination, not the starting position. If we could kind of shift our mentality or our cultures to that space, we might do a bit better.
Shifting the culture, hey? That's also on our list, isn't it, Sarah? Yeah? Yes. Now, I don't know how many people here have managed to go overseas in the last few months, but we're going to briefly take you there now. No, we're not going to. He's not there. What do you mean? You don't have it.
I've seen confidence and that's not it.
Do I have his phone number? Yeah, Claire. Where's Claire, darling? Claire Stewart. It's Jennifer's EA and our admin support person. She's so lovely. And would you mind going up to talk to Chris about... I can't take you overseas just yet. All right? It's going to happen, though. I am confident. We had a practice of this yesterday and it went swimmingly. Is that always the way? If you practice things and they go really well, then the real event...
I've got something happening next week which I'm really worried about similar things.
Falls over.
It's giving
okay.
Anyway. But
we're fine.
Can I add something?
I'd love you to, because we've got a gap now.
Seeing that you got time.
Yeah, do it. Go for your life.
Just picking up on that lived experience and even the discourse we had this morning, it reminded me when I first started in mental health and I was at the PA, like social work was seen as really non-clinical and we were only good at housing and Centrelink. That's where we sort of moved. So I think I'm using that as an analogy with sort of lived experience coming in sort of more recently. It's sort of, it can do certain things, but it's not really part of the main game. But the question then from the discussion we had this morning, do we want lived experience as part of the main game? Do we want it captured by the clinical system? And I think this is the tension that Heidi talked about this morning. We corporatise, we want to professionalise, clinicalise, whatever you want to call it, the lived experience. And is it going to be captured, like we talked about this morning, mental health being captured by the illness system? Will lived experience be captured by that system as well? And I think these are some of the things that we've got to think about the lived experience. Where does it fit? How does it work? I think there's a lot more thinking about this than just we need more peer workers in the public mental health system or in the private system or in the NGO system.
And we did hear there are different views on that as well.
We did hear there are different views on that, correct.
Yeah, so maybe it's a bit of everything. It's putting that lived experience in all of the different pockets. Yes, is that right, Viv?
Yeah, so like I definitely am in the cohort of people who do support the professionalisation of the peer workforce. I think we're here, we're working in services already. And there's a lot of support and thinking that still needs to be done around that workforce. I think in terms of not just community mental health services, but also into health and hospital services and more clinical and allied health settings. Like I think peer workers and lived experience workers need to be meeting people where they're coming through. So if whatever door that they're coming through, they're going to have access to a peer worker or someone with lived experience, because that provides something really meaningful. And we've heard about these peer first, peer last models, and I think there's some real value in that type of thinking. So I don't think we should be thinking about, we don't need a lived experience workforce here, we should just have them over here. I think they're needed across the entire system, and not just the health system as well. We need to be thinking about, more broadly as well. I think the lived experience peer workforce comes from a very human rights based approach, and therefore, I think we can bring something across the table at all levels of the system that's really valuable and really differently, that perhaps other disciplines can't necessarily bring to the table.
If you've got a table, make sure you've got a lived experience person there.
Yeah, and I also absolutely 110% believe that we can professionalise this workforce and still keep our peerness. I think that's really, because I think that's really important, and those accusations have been thrown around out there. I've heard them before, is that, we become co-opted when we're walking into workplaces that don't understand our role and value, don't have management support, has unsafe cultural environment for us to work in, being asked to work outside of our scope of practice, not being remunerated or valued, have no career progression opportunities, have no decent training or professional development or supervision opportunities, being set up to fail. I think the more important question is about what's the structures and the supports we're putting around our peer workforce so that we can thrive and give the value that we know lived experience workers bring, while keeping the longevity and sustainability of the workforce and not being asked to co-opt in our values.
I think, yeah. That was definitely worth stretching the applause muscles. I think we're still waiting for New Zealand. Yeah, well.
It's a long way away.
It is, isn't it? Yes. But we have a superhero here today who's going to ride in and rescue the day. It's Brett Hall. Now, Brett's going to talk about the Queensland government's workforce strategy. It's a 10-year strategy. It came out of their broad workforce summit in May. And Brett's here really to try and help us understand how we can harness any of the opportunities in this strategy. So, Brett, take it away. Thank you very much.
Thank you very much, Emma. And look, great to be here to talk about the Queensland workforce strategy. And look, we've heard it said a couple of times already that workforce issues are one of the biggest challenges facing the sector. And in all of the conversations that we have across the breadth of the Queensland economy and labour market, it is a very common story. So it's certainly by no means a challenge being felt by this sector alone. Almost every sector that we talk to is saying workforce and workforce-related challenges are the biggest factor, the biggest issue that they are facing as an industry or a sector or a region across Queensland at the moment. That was demonstrated again yesterday. So the ABS yesterday put out their latest unemployment data. And unemployment is the equal lowest it's been in Queensland since records began back in the 70s. The labour market is extremely tight. And therefore, we are here talking about potential reactions and potential solutions in response to that. Workforce is a significant priority for the Queensland government, and this really came about throughout as we came out of COVID-19 and the economy started to recover. Who would have thought 2.5 years ago, in those early days of COVID-19, that we would be here talking about a record low unemployment rate and a tight labour market? But here we are. This has been a significant area of focus for the Queensland government over the last 12 months or so. So what I'm going to do over the next couple of minutes is talk for a couple of minutes about the journey that we went on to get to the point of having a workforce strategy, talk about some of the key aspects of the workforce strategy, what does it contain, and then how can it be utilised by the sector in terms of putting the sector's workforce strategy together and addressing some of those skills and workforce shortages that are being felt day in and day out. There we go. Now I've broken it. There we go. All right, so we mentioned the Queensland Workforce Summit. So the Queensland Workforce Summit was held back in March this year, quite a significant event that was really focused on coming up with solutions both to immediate workforce shortages right now and setting up Queensland for opportunities in the future and really positioning Queensland's workforce as a driver of our ongoing competitiveness and prosperity. That was supported by a whole range of industry and community roundtables to delve into specific issues and was also supported by some engagement through the Queensland Government's Regional Community Forum. So there were 7 concurrent sessions held in regional communities throughout Queensland. That was supported by a quite extensive piece of research and analysis that informed the development of the workforce strategy. Now, what's on this slide here is a bit of a snip of one of the infographics that's in the strategy document that you can find on the website, and I'll show you where to find the strategy shortly. But what I particularly want to draw attention to out of this slide is the dot points in the column on the right-hand side. Now, based on some analysis of a whole range of labour market data, including employment projections published by Jobs Queensland, there was some work done to identify where are the most significant workforce challenges and workforce pressures in the coming years. The 5 most significant workforce pressures are summarised there on the right-hand side. And you can see that the top 2 really, I guess, demonstrate for this sector where some of the challenges are, and that's the healthcare, social and education workforce at both those at the degree qualified and experienced level, but also some of those more entry level and vet qualified roles in the healthcare and social assistance sector. Of course, there's challenges across other parts of the economy. We've talked briefly about welders, some of those technical skills, the skills across many parts of our entry-level services sectors, as well as our traditional trades. Now, that's not to say that that's the only sectors that are experiencing workforce challenges. Of course, there are others, but that is based on the analysis that informed the workforce strategy, those that are projected to be most significant in the coming years. We talked a little bit earlier about some of the issues being complex and multifaceted, and it's not just about skills, and it's not just about workforce attraction and retention. It's around how all of the different factors, including pathways from school into workforce and from training into employment, come together as a multifaceted approach. And that is where the areas of focus under the workforce strategy have attempted to bring some of these things together. So the workforce strategy has 5 focus areas and a series of actions that sit beneath each of those. So the first one of those focus areas is workforce participation. And this is really about how do we ensure that we are creating the opportunity for every possible Queenslander who wants to work to be able to work and succeeding in the workforce. There's also a few other things in here around making sure that people are able to fully participate in the workforce. So the ABS data I mentioned came out yesterday, and it continued a trend of what's been happening for quite some time, which is right now in Queensland, there's 190,000 people who are currently employed but are saying that they're actively seeking more hours than what they're currently working. So how do we tap into that workforce to be able to address some of the shortages currently being experienced? The second focus area is around local solutions, so a place-based approach. We know that Queensland is a large and diverse state, so ensuring that we are tailoring workforce approaches to the local region and the local context. School to work transitions, this came up really strongly in the Workforce Summit. When the Workforce Summit was held back in March this year, the borders were still, I think borders may have just opened from memory, but certainly travel was still pretty heavily constrained, and there was a strong focus on saying, well, how do we grow our own in regions and in local communities with the people coming out of the school system? Really key there is also the link between schools and industry sectors and making sure that there's really strong partnerships at the local level. The fourth is workforce attraction and retention, and there's a couple of layers to this. The first is around employers, particularly smaller employers, really needing to think differently around they attract and retain staff. The way that attraction and retention worked a few years ago in a different labour market, some of those strategies to attract and retain staff may need to change, and what supports are needed for particularly smaller employers to be able to navigate those labour markets. And there's also those broader sector-wide strategies for sectors that are experiencing significant challenges. And the last focus area is around skills. Now, skills are always part of the solution here, not the only solution. And this is around how do we ensure that we are investing in the right skills, the right qualifications through vocational education and training and the university system as well. There is a very strong focus that runs through the strategy on shared responsibility. Government can't do this alone. Industries and community sectors can't do this alone. It is shared responsibility and a focus on partnerships and collaboration. And you can see, if you have a look at the action plan that sits within the strategy, the word partner and collaborate comes up time and time again, and that's really quite deliberate. And the sector's taking the charge and leading their own responses is critical to this. And I think today's summit and the commitment to take forward a workforce strategy for the sector is absolutely essential. So government can set the high level parameters, but this is an economy-wide strategy. It's not going to perfectly hit the exact notes that are needed for every single sector. It's really an overarching framework that sectors can then come in behind and look at what does it mean for the specifics of the sector and what's important. So what does it contain? So there's 33 actions in the action plan in the strategy. I'm not going to go through them one by one. I'll show you where to find a copy of the strategy, and you can go through and have a look at the actions that are aligned to each of those focus areas under the action plan. But what I will focus on, which is normally the ones that there is the most significant amount of interest in, is where's the new investment going in the workforce strategy. So the workforce strategy and its action plan are underpinned by $70 million in initiatives that build on the broad range of other existing support that the Queensland Government has. So the Queensland Government this financial year alone will spend about $1.2 billion on skills and training and workforce support. We've had mentioned a couple of times already of some of those programs, and I would really echo that emphasis on finding out and tapping into the programs that are already there. You don't need to advocate for them. They're not recommendations to government. They are already there and can be accessed. Certainly would encourage you to think about that through the development of the workforce strategy as well, to be maximising what is already available for the benefit of the sector. But some of the new things are, so there's a $20 million Workforce Connect Fund, which is supporting industry and community-led projects focused on workforce attraction and retention and building workforce participation. That's open for applications as we speak, with applications for that closing towards the end of this month. There's a network of industry workforce advisors being established, which are intended as a network to work directly with employers across the state around their workforce and recruitment and attraction challenges. Expanding some of our existing programs, a Gateway to Industry Schools, the Diverse Queensland Workforce Program that's focused on our migrant and refugee workforces, increased support for micro-credentials and increased support for pre-apprenticeships. There's a focus on partnerships with the most rural and remote communities in the state, recognising that the sorts of workforce challenges in Cunnamulla can be somewhat different to those in Cairns, even though they're both technically regional areas. Additional support for apprentices and trainees to complete their training. The Department of Education will be establishing regional school industry partnership managers. And what this is dedicated staff in education regions across the state that will be facilitating those partnerships between schools and local employers at the local level to support those school to work transitions. And the Department of Children, Youth Justice and Multicultural Affairs is establishing a multicultural affairs settlement team, which is focused on improving workforce outcomes for migrants and refugees in our workforce. One action that's not on here that I will mention that's potentially relevant to today is one of the actions in the action plan is that Jobs Queensland is going to be driving forward sector-led partnerships with the health and community services workforce around workforce attraction and retention challenges, and understand Jobs Queensland's already been talking to QAMH around some of the plans for that over the coming months. So through the process of developing the workforce strategy, there were dozens, if not hundreds, of examples of really good practice that came up in the course of putting the strategy together. And one of the things that we've been really keen to do is ensure that we're able to highlight and share some of those examples of really innovative and successful models and projects and approaches around responding to some of those workforce challenges that are currently existing and strengthening workforces in a particular industry or a particular region. So what was launched alongside the strategy was what we're calling a workforce collaboration hub. Now this is available on the website where you can find the strategy. There is a whole range of case studies that are on there already around particular examples of successful models and examples of good practice, but we're seeking to progressively build that over time. So the other thing you'll find on that website is a form where you can submit case study ideas and examples of good practice that can be worked up into case studies for that particular site. Really encourage you to jump on there and have a look, and also really encourage you to submit those case study ideas. When you know of a particular organisation or a particular sector that's doing really good things, a particular sector that might be hosting a Jobs and Skills Summit perhaps, and to support that, there's a LinkedIn community that's been developed. It's called the Workforce Collaboration Hub that is designed to drive discussion, collaboration, information sharing about what's happening around strategies to respond to workforce attraction, retention challenges, and workforce issues more broadly. So really encourage you to jump on there and have a look. Really encourage you to join the Workforce Collaboration Hub. I won't be offended if you get out your phone and do it right now, but the success of that hub is really only as good as the content and the engagement that happens on there. So we are really encouraging people to join that hub and participate in what's on there. So to find more information on the workforce strategy, queensland.gov.au/workforce strategy. It was released a couple of months ago, so just over 2 months ago now, and the actions in those action plans are progressively being rolled out over the next couple of months. So some of them have already started, some of them will come over the next couple of months. So really encourage you to keep an eye on that website for more information. And to also think about how some of those initiatives can flow into the way in which you respond to workforce challenges in your sector, but also how that can flow into the workforce strategy. And we're more than happy to keep talking about how we can link up some of those challenges identified through the strategy with some of those particular programs and initiatives and available funding through the strategy to come up with some workable solutions. So more than happy to answer any questions on the workforce strategy and what the Queensland Government's been doing in this space, and also very intrigued to see the reaction from the panel as well.
Intrigued, and we love that phrase you used there, available funding.
I didn't say weaponise.
No, but available funding, that's good. We like funding that's available. Perhaps I could ask the panel if you have any questions of Brett or opportunities. Do you see?
I would ask about your Workforce Connect Fund, which is great to see that allocation of money towards it. Is there a particular allocation that has specifically been put aside for the mental health sector? Or community mental health sector?
So it is an economy-wide fund, so it's a competitive process, and it is open for. So the stream of funding that's available now is what we call the large scale project stream, which is the majority of the funds under the fund, and it's for industry and community-based organisations to bring forward. Applications, but there's no specific funding that's been quarantined for any particular sector.
Which means it's going to be highly competitive, and therefore perhaps the chances of that coming into our mental health sector might be challenging. Would be my observation.
Yeah, difficult to say without with it currently being open for applications.
Come on, mate, we're mates. Come on.
But it is an economy-wide fund.
Yeah, so we are up against the welders. And
but even building on that, it talks about, allied health bachelor degree sort of, in the sort of health and social services areas, which again has implications, if you're looking at lived experience or, paraprofessionals, etc., that we need as well as part of our workforce.
Yes, and I mean, I know that the Workforce Connect Fund is something that the Alliance has looked at, and we will be looking at it further once we've developed our strategy. I'd like to just say thank you as well to the Jobs Queensland guys that have come in today to be part of the conversation here. Really appreciate you being in the room. And thank you very much, Brett, for racing to the rescue there. For me,
Pleasure.
Personally, I owe you one. Really appreciate your time and look forward to,
Thank you.
continuing our conversations. It is very important to you pass over, you can just walk through, do a little dance. Thank you very much. It is very important, I think, we've talked in the Alliance about building these relationships, not just with the health department, but seeing what other opportunities there are throughout state government and throughout federal government as well. And are there opportunities overseas as well, is what I'm asking Chris, who's our legendary sound technician today. I see some confidence up there now, Ivan, so that's really, really heartening.
I think it's confidence.
Yeah. Oh, yes. Okay, so we're taking you overseas. Now, I know that the federal government is looking overseas to New Zealand for advice on a wellbeing measure in its budget, as you may have heard Jennifer saying earlier. Well, we too are looking to New Zealand, where there is a pretty compelling story to tell in terms of building skills in the community mental health sector. And to tell it, we're joined by Andy Bunn, who is Apprenticeship Advisor with training organisation Career Force. And I'd just like everybody to give Andy a big hello and applause. Woo, woo, woo! Because Andy can't actually see us. And, so that, he knows there are people here, and we're really excited to hear from you, Andy. Take it away, Andy Bunn.
Kia ora, everyone, from a damp Christchurch today. But it's really great to have this opportunity. I'm quite passionate about my role as an apprenticeship advisor with Career Force, working in the community mental health and addiction sector and also the peer sector. So I can go off on a bit of tangent every now and again, so you might need to pull me back. But what I thought I'd do is just give you a bit of an overview of what I do. My role is to work with community mental health providers, peer support, addictions providers to establish training within the workplace, on job, earn as you learn training, to ensure that the workplace have got capacity to support the apprentice learner, and to provide pastoral support and coaching and assessment support for that learner. One of the things I've found over the course of my job is that most of our learners have had a very difficult experience at school, and there's a lot of anxiety and a lot of fear related to Career Force training or the Level 4 apprenticeship program. And I think for me, the thing that really works is having the ability to make a connection with the learner or the group of learners, understand a little bit about their worldview, what their pathway has been to the point that they're at now, and how I can support them moving forward. Often school was quite traumatic for people, so we need to kind of figure out how we're going to work together around that. And, I have quite a few of my learners will say to me things like, okay, like if I sign up for this, you'll do the first assessment with me, I'll make a bloody rubbish, stab at it, and then you'll kick me off the course. And I said, no, it doesn't work like that at all. What it is about you and I working together to find a way to move this forward, and I need to be able to understand what works best for you, what's your learning style, and then we'll work through it in the sense that you will get multiple chances to provide evidence. It's not like a university course where you have to reference stuff. It's all about providing me as your assessor with enough evidence to make sure that you understood the learning material, you can apply it to your practice, and you can give examples of how you support the people that you're walking alongside. And again, it's about that connection. I've had apprentices or apprentice learners that have been really suspicious of me because they see me as an authority figure. And then it's about using some of that limited self-disclosure about my own journey. My school life was not particularly fantastic, and I gained all of my formal qualifications from the age of 30. So just sharing a little bit about that, it breaks the ice. I've also had, apprentices or potential apprentices say to me things like, what gives you the right to sit in front of me and talk to me about this sort of stuff? And again, it goes back to that school stuff, like how do I get over those barriers? How can we talk about learning in the workplace? So what I tend to do is look at the qualification with them and say, this is your job. All of these modules in here based on the wonderful work that you do and the amazing support that you provide to the people you walk alongside and their families. And once we start breaking it down and going through that and seeing that they're actually doing the do, and it might give them an opportunity to brush up on a few skills, then usually things will go pretty smoothly from there. And like I say, I can't really emphasize more about that, the personal connection. You know, without that personal connection, without that, you know, being a little bit curious about things, about their journey, what their family life might be at the time, what are the pressures, what are the things that could impact on this person being able to successfully engage and complete their apprenticeship program. And it's one of the wonders of our job as apprenticeship advisors that we have the flexibility to be able to work with people on an individual basis or a group. So if you've got any questions, please feel free to jump in, because I prefer questions. It stops me from just rabbiting on and on.
Okay, we do actually have a question, Andy. So Jennifer Black, who is our CEO, who I think you've met, has a question.
Hi, Andy. Look, I think, Andy, when I was in New Zealand, we had this conversation, what I was really taken with, and people won't really understand how your apprenticeship program works, that it's a 2-year program, it's for community mental health workers, and you have a separate one for the peer workforce.
That's right.
So could you talk about the mechanics of that and how you work with industry to actually get that right for industry?
Yeah, no worries. So for working with industry, you know, often it's with their HR people or their managers or particular team leaders. So if we've got a community mental health organisation that has an addictions arm, a peer arm and a mental health arm, obviously we're looking for the right qualification. But what we're really looking for is that the workplace commitment to supporting on-job training to ensure that the workplace understand that the apprenticeship program is made up of 14 modules. It's at 134 credits, and part of the modules there's going to be some practical assessments or practical things that need to be observed within the workplace. So the apprentice doing the do. You know, we call it capturing naturally occurring evidence. You probably do the same. So it's ensuring that there are people in key positions, go-to people in those organisations that the apprentice can go along to and say, hey, I've started this module. There's a practical assessment here. I need to be observed on how I maintain and establish relationships with my whāora, the people I support, and their whānau or their families, and have a conversation with that person, because it would be inappropriate for me to go in and observe this sort of stuff. And the reason that we have these on-site people is that they are there walking alongside our apprentices. And if it's evidence that they can see or have heard or have been a part of, it should be quite easy for them to complete that part of things. We do emphasise that the workplace, when they sign the training agreement, they are signing to say that they're supporting the apprentice to have opportunities to engage with different aspects of support work, different aspects of mental health and addiction support work and peer support work that will enable them to complete their apprenticeship program. And in that case, it might actually mean that they go and do a little bit of placement time in a different part of their business to ensure that they can meet the practical assessments. Everything is delivered online. So we have a digital platform called Akatoi. So all of the modules are loaded online, and they have the theory-based stuff, which is supported by the learning material. There's strong links between the learning material and the theory-based questions. And my job is to support the workplace and the trainee to ensure that they can make those links, that they understand the learning material. A lot of the time, it's because our apprentices didn't have such a good school journey, they don't understand the questions. So it's then putting the questions, reframing them and helping the trainee or the apprentice to understand what the question is asking them, because they're quite generic and they've been written to be delivered across multiple sectors in some cases. Once I've got to admit, once they understand this stuff, they're away, they fly. Like I say, I'm really quite passionate about this. It actually makes me feel quite emotional to see the growth in people once they get it, and once their workplace are on board and they've got the right support. this flies.
Yeah.
I'm so impressed that, I've been working for Career Force in different roles, but to actually be out in the community and have that degree of flexibility within and be invited into a workplace and be able to establish this stuff and make connections with key people from community mental health services or peer services or addiction services, to get them on board to support workplace training and to support their trainees, their apprentice learners. When it all comes together, it's an amazing thing to be a part of.
We can hear that passion in your voice, see it on your face too, Andy. And I know when we spoke earlier about this, you said this is the best job that you've ever had.
Absolutely. Yeah.
I think Jennifer's back up. Here we go. Yeah.
Can't help myself. One of the other things, Andy, I was really impressed with when we talked about this was that it's a 2-year program, but students can fast track it if they have those opportunities.
There you go.
Yeah. Now, you see, when we put this together, I thought you just wanted me to rabbit on about what I did, not so much about the qualification, but now I'm kind of getting there. Yeah, the qualification's 2 years, so they've got up to 2 years to complete it. We wouldn't hold anybody back. There are people that will fly and will want to complete it quite quickly. I think the quickest I've had anybody go through this has been like 5.5 months.
And how do people get into it? Like, do they get the job first and then on the job?
Absolutely. It's an apprenticeship
the
program.
employer says you've got an apprenticeship now and these are the modules that you'll do and this is Andy, he's going to help you? Is that how it works?
So for the Career Force part of this, because we're not a polytech or a university, you have to be employed to enrol in Career Force training because we're an industry training organisation which is now being absorbed into that larger kind of training institute of Tipu Kenga with the restructure that's going on in New Zealand. But historically with Career Force, you have to have a job, you have to be working in the sector, and your job must be relevant to the apprenticeship that you're enrolling in.
Okay. Andy, we have a question from one of our expert panellists here, Viv Kissane, who's the CEO of a community mental health organisation in Queensland. Viv?
Yep. Kia ora, Viv.
Yep. Hi, Andy. We're actually a peer-led organisation as well. So
Awesome.
I do have some particular interest around what you're doing in the peer space. So I'm a bit worried here in Queensland that we're putting all our eggs in the one basket with the Certificate 4 in mental health in peer work. And I love what you're talking about because I think perhaps an apprenticeship or a traineeship actually could be a really good option for us to add to our basket, particularly with our particular, cohort of people looking to do this work do have, I think, extra set of barriers into entering into study and having career pathways. So I love what you're talking about. I love that, the words that you're using around connection and support for that person. I guess I'm interested around what are the incentives for the organisations to actually accept people into traineeships into their organisations?
I guess that, with most organisations in New Zealand, there are kind of different incentives. I mean, one of the main drivers, I guess, for a lot of organisations is that they're contractually obliged to their funder, whether that's the District Health Board or the government or the Ministry of Health, to have staff trained at level 4. So, Career Force have responded to that and developed these apprenticeships across the health and wellbeing sector, including peer and mental health and addictions. The other incentives is that the New Zealand government have made apprenticeships fees free. And then after COVID, they introduced a fund called Apprenticeship Boost. And that was to get people into training, on-job training, earn as you learn training. And they provided financial support for that attached to that particular apprentice, a monthly payment to support the person to complete their apprenticeship and any associated costs of on-job training. So those are the incentives. The incentives too here is that we have a pay scale where if you complete your level 4 qualification at pay equity, you get paid $28 plus an hour, which might not be much for Australia, but for New Zealand, it's quite significant for the kind of level 4 support workforce we have here. So those are some of the incentives. I mean, a major incentive for a lot of our apprentices too is just they want to learn. This is a new opportunity. I said to Jennifer when we were in Christchurch, there's a term that's used a lot here. It's called second chance learners, and I'm a little bit not okay with that term, because for a lot of our learners, they didn't even get a first chance at school, let alone a second chance through going back into education later at life. And I think to see the passion that people have to want to make a difference in the sector that they're working, and having the opportunity to work, to train, to learn through an apprentice style program with a flexible approach from us to try and meet their individual training needs as well as a group and their learning styles, that's part of the incentive as well, having that one-on-one support from somebody like myself.
Somebody like yourself, Andy, you're pretty amazing. They're lucky to have you. Yeah, no. I think
mate, there's heaps of me. I'm not unique.
Definitely
not unique.
It's just every New Zealander. They're all great, aren't they?
No. I'm a palm anyway, so. There
you go. Andy, thank you very much. Really appreciate your time today. Thanks very much for giving us a taste of the New Zealand experience. I think it's giving us lots of ideas.
Yeah. Again, I can't emphasise the connection. There are different ways for people to provide their evidence. They can make a mind map, take a photograph of it, upload it into Akatoy. They can record themselves, get somebody to film them talking about their assessment and the support they provide, give examples from their practice. It's not just about writing stuff down on paper or typing it. We can do, for people that, literacy and numeracy is a real barrier for them, we can do verbal assessments through a professional conversation that we call korero matanga. So there's lots of ways that we can support learners to ensure that they have a successful journey, and that journey is as an enjoyment. We're walking a journey together, and it's just figuring out how we're going to navigate that, how it's going to work for both of us, or for the group.
Terrific. Andy Bunn, thank you very much, everybody. Big applause, and hello, Andy, thank you very much.
Awesome, mate.
Now you can enjoy your Friday evening in Christchurch. Go out and hit the town.
It's just about beer o'clock, to be honest.
Yeah.
And, sorry about the technical difficulties, because I couldn't get in.
No, it worked. It's worked perfectly. Thank you. Thank you very much.
That's helped. And in my kind of messy, enthusiastic way, I can't talk enough about what a wonderful journey this is. I really enjoy it. I'm passionate about it. Love it.
Excellent. And Jennifer's saying we will talk again. So you get another chance. Thanks very much. All right, awesome. We'll say goodbye to New Zealand. Back home in Queensland now. But first, I guess I might just ask on the panel for a bit of a reaction to what you heard there, and that whole idea. I mean, you heard the New Zealand government's removed barriers to learning. They put incentives in there. You don't have to pay for the course. You get some payment while you're doing it. It sounds like it's good for the employers. Andy's extremely happy. So are you taking notes about this too over there in the Department of Employment, Small Business Training and Jobs Queensland? Barriers gone. Good. There's a workbook even there for you to write in. David, I think this would be sounding quite familiar to you. Yeah. So can you tell us how that worked for you? Sure. Not in our sector specifically, but in New South Wales?
Yeah, sure. So a very similar program with the Lambie Care in New South Wales. We started in 2015, and the big, bold idea was to create a work integrated learning pathway for people to acquire a bachelor's degree. The thinking was that perhaps people have engaged with learning in a way that Andy's described, where they've not had a good experience or they've not actually sort of felt confident that they can train or they can learn. And most of the people who ended up with a bachelor's degree never imagined that would be their life course, that they would ever, in their life course, find their way to a bachelor's degree. And the way we did it was incrementally. We recruited youth workers, we brought them in, and we addressed some of the barriers right from the start. So we did this thing called an upfront assessment of needs, and it looked at every conceivable barrier, even down to whether or not they had stable accommodation, whether there was a risk of domestic and family violence in their homes, all of these sorts of things. We looked at LLN. When COVID hit, we started to look at digital literacy, because that became a new thing as well. And we worked to actually manage some of their barriers to move them into a youth work program where, in fact, they did closed loop learning. So they went into the workplace, they did some work, they come back into the training room, back into the workplace. And we used good old-fashioned sort of vet principles. Andy's a knight of the old code. We don't hear the language naturally existing evidence so much anymore. but it's part of what we used to call RCC. So you might have heard the expression RPL, recognition of prior learning. Yeah. What often is actually happening in the workplace is in fact RCC, recognition of current competence. So if you've been around the vet space for a long, long time, we used to have a thing called the Mayer Key Competencies, which were key competencies that were transferable skills that regardless of where you were in the workplace, you probably carried them with you. Over time, training packages got themselves twisted in knots and turned it into a situation where unless you learn it here, you don't know it. And so credit transfer became a matter of you have to have the unit code, the unit name to transfer credit. But you might actually have some transferable skills that exist from a very similar subject, but we can't recognise. So recognition of prior learning or RPL is a process where you can in fact recognise what's occurring in the workplace. So there was a bit of RPL, there was a bit of sort of direct training and assessment and using the workplace for work integrated learning purposes. So teaching people theories, but getting them to apply that to the work they're doing with clients. Doing clustered assessment where we'd actually reach across a number of subjects and do a meaningful project that had efficacy in the workplace that actually helped somebody, and then using vet technical expertise to actually map it back to the qualification. It's a risky thing when there's regulatory aggression. So if regulators are out there and they're anti-RPL or they're anti those sort of flexible learning approaches, it's a bit of a risky sort of thing to do because you've got to kind of justify what you're doing. We have a difficulty in this country around RPL. It's a difficulty in our interface with the universities. Well, if you've done RPL, you've done informal learning, we don't accept that. And I suspect the reason Emma's asked me this question is she knows exactly what I'm going to say about the RPL paradox. If we believe that the nationally defined standard as articulated on the National Vet Register is an adequate preparation for the workplace, then should not the workplace be an accurate reflection of the qualification? And if it's not, what are we doing? Like seriously, what are we smoking? Where we fall down, where we have difficulties with RPL, is where you have RPL mills. We have people doing dodgy RPL. We have people sort of doing tick and flick. And as Andy said, you can't really walk around the workplace with a clipboard and watch you do things. That would be creepy. A little strange. Might demonstrate some other skills in the management of that, of course. But I think there's ways to capture naturally occurring RPL. There's a way to give efficacy to that. There's a way to recognise people's knowledge, skills and experience. Because one of the problems for the peer workforce is we've got massive amounts of knowledge, skills and experience that may not necessarily have come into the orbit of someone who can actually assess that, credential that, recognise that, accredit that through a robust and reasonable process. So what he's talking about is, don't put people through traditional educational experiences that traumatise them. Don't teach people things they already know. Recognise what it is they know and then teach them in the gaps. The other thing I guess I kind of say to vet practitioners is the nationally defined standard. I was on the Industry Skills Council for a number of years, writing training packages, and I was always concerned we'd write something and say, if we set that as the standard, they'll just meet the standard. And I think there's a space past it. I would say look for those training providers who actually see the standard as something they sail through on their way to meeting a workforce need. But they should meet the standard, but they should actually be trying to do something better. There's something better. So closed loop learning, 265 people started, 229 finished their diploma, and we managed to retain them for a 2-year period. So that's paranormal activity in vet, right? Like that amount of retention, that completion rate. And it is. And I think that the reality was something similar to what Andy was saying, that the trainers were working with the supervisors were getting a benefit from it in terms of, and there was this sort of, coach don't poach kind of approach, and we were keeping people together and really giving meaning to what they were doing, but also making the assessment meaningful in the workplace. We did a deal with Australian Catholic University for an accreditation pathway, and they got significant credit into the university pathway, and then we sat down with ACU and said, we want to do it in the workplace. We want to do it by clustered assessment. We want to do it using the same sorts of tools and processes we've used. Dr. Howard Barth was one of our facilitators. I did some of the facilitating. The ACU staff did some of the facilitating. And we managed to take 65 people who were started as youth workers who had very little sense that they would ever get to a bachelor's degree through to a bachelor's degree. And the last time I checked, only 8 had left. But they'd all gone to the department, and that's not necessarily a bad thing when you're working with a regulator to have people you've coached to go into that space. I guess the message is it can be done, and it's about having leveraging off systems and processes locally. We weren't able to access funding in New South Wales, so as an RTO, we did it for $900 per person in order to actually make it happen. Andy talks about making things free. I know that with a lot of the training funds out there, there's a co-contribution. I don't mind the idea of a co-contribution because sometimes when people get things for free, they don't value them. Whereas if there's a co-contribution, I've got a little something to lose. I think there is something to that, and I'm sure that we could probably, crack a few bottles of red wine and argue that one all night. But I think there's something to that. I do, however, think that there are perhaps there should be opportunities for some concession that where some people might be doing it particularly tough, or where it's maybe a little unconscionable to ask them to dip into their pocket, that we have some capacity to sort of say in particular categories. So one of the things that we've done in other states with foster carers is that we've worked to try and find other buckets of money in order to fund their contribution, because I just will not take money off a foster carer for training, and even if it's only a couple of $100, not doing it. So we'll find another way. So finding those other things around the co-contribution is useful. Yeah.
And Brett's already said that there's available funding, right? No.
I think you're in trouble, Brett.
I'm really trying to keep the target off you, Brett, but it keeps finding its way back to you.
Brett's never going to come back. No, we're very, very understanding. But, I mean, that does give you some hope, I hope, hearing from both Andy and from Dave there. And also, QAMH has delved into this a little bit as well with TAFE Queensland and has looked at addressing one of the skills gaps in our sector. The end product is a new micro-credential. It's free and it's aimed particularly at new staff working within the NDIS sort of framework. Am I putting that correctly, Sarah? So, and you can find some details of this micro-credential in your summit workbook. It's all there for you. So here today, TAFE Queensland's Hayley Crumblin, who's a vocational curriculum specialist, and you can take us through the process of how that came about. Thanks, Hayley.
Absolutely. Thank you so much. So my name's Hayley Crumblin and I work with the product agency team within the Chief Academic Office of TAFE Queensland, which is led by Tracy Singh, the Director of the product agency. The product agency is an experienced team that specialises in the design, development and delivery of bespoke education and training solutions for both industry and government. Today, I'll be talking about the navigating the NDIS for the Psychosocial Workforce Micro-credential that we developed in collaboration with the Queensland Alliance for Mental Health and the consortium formerly known as Workability, which was funded by the Department of Employment, Small Business and Training. So a lot of assistance in this room. I want to say thank you for the opportunity to talk about this project as it is really close to my heart. The reasons for this are the work that is done in this sector really make a difference to the quality of life of people accessing its services. And the people that I had a privilege of working with on this project from QAMH, Workability, and the lived experience and industry representatives were dedicated, passionate, humorous, and really, really cared about the outcomes that we had set out to achieve. Overall, it was an enjoyable project that really felt important. Before I get started, I should explain what micro-credentials are to TAFE Queensland. For us, a micro-credential is a short, sharp, accessible and flexible training solution that meets the national micro-credential requirements and will be delivered with an assessment component. Our micro-credentials take between 2 and 10 hours to complete, depending on the micro-credential purpose and design. TAFE Queensland micro-credentials can be delivered online in our new state-of-the-art course gateway system, which allows for ease of access and enrolment and gives the opportunity for industry-endorsed badging for recognition of completion. The product agency at TAFE Queensland, and I don't have the slides. So.
I can drive them if you like. You just tell me.
You.
Yeah.
Excellent, excellent. Yeah, thank you.
Is that the right one?
Yes, it is.
Okay, good.
Excellent.
Oh, fun.
The product agency at TAFE Queensland has partnered with a range of different industry sectors to design and develop micro-credentials, and you can see some examples of that here. And next slide. Thank you. The micro-credential was developed in direct response to the research outcomes that were achieved during the Community Mental Health Workforce project completed by QAMH in 2021. As a part of that project, it was identified that even though the mental health and wellbeing workforce in Queensland was highly skilled, there was still a range of skills and knowledge gaps existing. Gaps were identified in the areas of understanding mental illness, recovery practice, professional boundaries, NDIS psycho-supports, and trauma-informed care. We set out to design and deliver a micro-credential that would contribute to filling these knowledge gaps. In order to achieve this, we knew we would need to leverage from the skills and experience of the mental health and wellbeing sector and the people with lived experience. It was really, really important to us that the consultation was authentic and that the information that we provided to workers in this micro-credential would build on the capacity that already exists in the sector and would assist new entrants to the workforce to understand the fundamental principles and practices that guide it. Our goal was to provide foundational knowledge in the areas of what mental health and wellbeing are, how to navigate the mental health ecosystem, how recovery-oriented practice is used in NDIS to provide psychosocial supports, the importance of applying trauma-informed care according to best practice principles, applying professional boundaries safely and effectively, and that's for the safety of the worker as well. So I think that was something that has been touched on a little bit today. And an overview of the legal framework for the mental health and wellbeing sector. It's a little bit hard for some new people to navigate that. Once we selected the required information during consultation, we worked on how this information could best be presented to the workforce for maximum learning uptake and retention. One of the goals we had was making sure that the information was able to be understood in the true context of the industry and the workplace and not just in theory. One of our solutions to this was developing a series of animated characters that are introduced with their background stories in animated videos at the start of the course. This is Lillian. She is one of the animated characters or personas that we developed for the course. During her video, we explain her personal situation, her backstory, and a few things that just make her her. These animations and activities allow us to guide the student through the simulated learning that reflects the types of situations that they are likely to be exposed to. It also makes the content more personal and relatable, which is really important in this field of work. The next one. We also wanted to make our content appeal to people that have a variety of different learning styles and to make the content approachable and easy to digest. We have achieved this by sequencing the content logically, breaking the content into small components, and presenting the content in a range of different ways to activate different learning and retention. And here you can see an example, and this is actually interactive when it's online, and then the next slide shows just another example, so you can click through. We've clicked through the right side and left the left side as it was, but when you're learning, it's actually interesting to shift the mind from doing one thing to the other because it really helps with retention, and it also helps different learning styles their needs being met at the same time. Micro-credentials are solutions-focused and can be created to support and achieve a range of different outcomes across any sector. People are most engaged in their work when they know that they can make a difference, and people are most likely to be able to make a difference using their work when they understand the purpose of their work, the context of their work, and where to obtain the information required to complete the work effectively. And this is what this micro-credential does. It explains the purpose of the work in the sections about the NDIS psychosocial supports and professional boundaries. It explains the context of the work by providing foundational knowledge in the areas of mental health, recovery practice, and trauma-informed care. And it provides the information required to complete the work effectively through practical tips and links to services, legislation, and resources that will benefit the worker and enable them to make a truly truly make a difference in a sector that really matters. Thank you.
Oh, thank you. Thank you so much, Hayley. Hang about. So, look, Mentimeter is still happening. 2725714 is the code to get in there and post a question. And there are some questions that have come up, but I suppose I just wanted to go to the panel after hearing from Hayley there on the micro-credential that has been developed with QAMH and started out with workability, Queensland as well. So, Viv, have you got some thoughts on the micro-credential or?
Well, we were just actually
Questions?
commenting about the lived experience involved in that. So again, I mean, the framework of it, the things that you're talking about in terms of identifying the gaps in training and whatnot. It sounded like there was a lot of similarities in terms that would also be applicable to the lived experience workforce. So again, I think it seems like it could be another really good option for us to explore in terms of different pathways for people to enter into a lived experience workforce.
100%. And micro-credentials can be tailored to anything, and I think that would really work in that sense. Even this particular micro-credential would have a lot.
But this was specifically designed for the NDIS psychosocial support.
It was, yes.
Not lived experience specifically.
No, not specifically. Yeah.
How was it funded, this work? Or is that something that... available funding! I think that's a new superhero term, right? Available funding, sorry. Just too much coffee.
Yeah.
Okay.
So it was TAFE Queensland, QAMH, workability, and then funded by Department of Employment and Small Business.
DESBT.
Yeah.
David?
Look, I think it's a really good example of something that can be produced that actually has utility for a carrot for workforce. So one of the things that can be a bit of a struggle in service training, this certainly helps. I think sort of that update PD sort of stuff, but also people who, for a whole Cert 4 is a lot, right? I don't know if I can do that. I don't have much confidence, or I haven't had great experiences at school. This could be a nice taster. It could be a nice thing to use as an onboarder, something to nest inside your induction. So your induction might be this big and this micro-credential might sit inside it. Great to use with your volunteers to actually help move people through. And I think the other thing, I'm aware of some of the development of the interface. TAFE has got the learning style kind of thing right, in terms of it's easy to use, it's easy for someone to access, it's easy for somebody to actually walk through themselves and be sort of student-led learning. So I think it's great, and I think actually is probably the way forward in many sectors around how we actually get people to engage without expecting them to eat the whole elephant in one hit, the idea of a Cert 4 being too much. Yeah.
It's just like one toe of the elephant.
Yeah, that's it.
But it's also one of those short-term, because most of the things we talk about is going to take 3, 5, 10 years, and this is about trying to build, whether it's the lived workforce or broadly, much quicker way than what we have. I think it's a great way to do it.
Yeah. And that really was one of our focuses during the development of the micro-credential, was really getting it on the ground quickly, making sure that it's digestible, making sure that it's approachable, making sure that the LLM level is right, that the way that you move through the course is intuitive, and that we really had a lot of robust discussions, and they really were robust some days, making sure that what we had in there was vitally important and that there wasn't fluff and theory and other things that you don't need. It was really just, this is where you're at, this is what you need to do, this is where you can get more information, and we think that helps with what you're talking about.
That's terrific. We've got a question that you might want to hang around for. Hayley as well. This has come in from somebody in a small non-government organisation with 100% lived experience staff specialising in mental health. And this person says the only funding to encourage traineeships within our business is Cert 4 in community services. Why are we not funding any mental health courses? Who can answer that?
Not me,
Not
unfortunately.
you, Hayley.
It's
I
a great
don't-
question.
It is a good question.
I don't want to jump on speak for DESBT, but I'm pretty sure that Cert 4 mental health's on the HLS list, is it not? And the peer support one, they both are.
Okay, so there
It-
are a couple of
it
mental
may-
health.
it-
I did wonder.
It may be the RTO they're working with doesn't have that funding in their
Yes,
contract,
that's right.
but it's certainly on the HLS list. Both of them, the Cert 4 mental health and the Cert 4.
Well, the
Mental
other
health
problem
peer.
we have in Queensland is that there are actually only 3 RTOs in Queensland that will deliver the Cert 4 and mental health peer work for the whole state.
There's not many.
Okay, there's another one to add to the list, hey? It's already on there. Yeah, it's already on there. Brilliant. Hayley, thank you so much
you.
for telling us all about that today. Hayley Crumblin from TAFE Queensland. Thank you very much. Okay, got about 15, 20 minutes left. Now, I guess on the list is having the courses available. It's also about supporting the people through their study. We've heard some of that from Andy today and from David. But it was also a core aim of another project that QAMH has run this year, the Peer Workforce Student Mentoring Program. It was a pilot project. And again, you can find the information on this in your workbook there. And if you're on the live stream as well, that workbook has been emailed to you. So you will have that there. It's on our website as well. But the project coordinator is Amanda Haberman, who's going to tell you all about it now. Thanks very much, Amanda.
Thanks, Emma. I don't know, in a few minutes, I could be talking for hours, but I'll keep it brief. And I've been doing my thing for the workforce. I have 7 children.
Oh, oh my goodness.
And 7 grandchildren.
Well done.
But I guess for me, for a long time, what's been important is growing the peer workforce. I think I was working as a peer before there even was a thing as a peer worker. And so I was very lucky to be able to be one of the 30-odd people around Australia who was recognised back in 2014 by the National Mental Health Commission with the Peer Champions program. And so we had to have at least 5 years of peer work up our sleeve to qualify for that program. And we were given the opportunity to be RPL'd through the Cert 4 because it had just been put together, and also to get our training and assessment to be able to then go back and deliver it. So we're really excited because a lot of us around Australia, here in Queensland, have been doing this work for many, many years. But to have a formal qualification like the Cert 4 in mental health peer work was just amazing. And so we thought at the time, we didn't just have our own personal lived experience. This expertise, this uniqueness that we bring to this workforce was a real thing. There was going to be a qualification. So with that qualification, as a peer champion, a lot of us really struggled to be able to get RTOs to buy in and put it on scope. And that was throughout Australia. So here was 30 people that were trained to be able to go back and teach this and grow our workforce. But unfortunately, there was a few problems there and that hasn't really happened. So what we see there's only 3 RTOs in the state that are delivering it. And what we hear is, we've been hearing for many years, is that the students who've done it said it hasn't been worth, they haven't got anything from it. We've heard that industry is not even recognising it. It's part of a prerequisite that, you have at least a Cert 4 in mental health peer work. But some organisations, especially peer-led organisations, think, oh, if they've got a Cert 4, we're not even going to take them. We'll rather, look at who they are as a person and what they bring to the job. So we took our concerns. I'm also part of QLUN, which is the Queensland Lived Experience Workforce Network, to the Alliance, and kind of said, help us. We've got to do something. This is not good, and it's not working. Also, the emerging peer workforce has been emerging and growing, and we have been learning. And actually, this certificate is no longer contemporary. It's not actually. It's not working. So we're very, very lucky that the Alliance that listened, said yes, and started connecting this with all these very important people that were able to help us, like DESBT, Workability, and and TAFE Queensland. Surprise, surprise. So one of the important things with this cert is that when it was designed and put out there, it was designed to put out there for people who were already doing the work, like myself and the other champions that were selected. But now, as we're building capacity, we want to grow this workforce. We've got people coming in that want to do it, but have got no idea. And I was talking to a TAFE teacher at a conference in Western Australia, and he's just been delivering the Cert for mental health. He goes, we've got a big problem. We've got people coming in straight from hospital that, I've got a lived experience, I'll do this course, and they're struggling and there's problems there. So this program, we thought, well, we've got to do something. We're going to go in there. And I think the issue was a lot of people think the poor consumers, they need extra support to get through the Cert 4. But it wasn't about that at all. We wanted to get in there, walk alongside our peers and find out what are the real challenges? What are the real problems that are going on? Because it's not them. You'd think the mental health system is a difficult one to navigate. Try the bloody vet sector. I mean, these guys have got two different, sort of lenses or things to try to navigate through. And absolutely, Andy was perfectly correct. Some of these people haven't been to school for 30 years. They have experienced trauma, childhood trauma. It has had long-term impacts. Their education, like I remember getting the strap if I got it wrong at school, and I'm not that old. So I think it's really like, what were the issues? So our beautiful, and I'm going to ask Simon and Michael to stand up.
Oh, well, you need to come down here, guys.
Come down here. This is Simon Clout, who was our peer mentor up in the Gold Coast.
Come on over here.
And Michael Mawson, who has been our peer mentor based in the campus up at Mooloolaba. Hi, everybody. These wonderful human beings have been at the coalface. They've been based on campus in TAFE, and they've just been talking, hanging out with these students. And we have shone the torchlight. We have identified a list like this of issues that is going on. This is not about the peer. This is about the system that we've got that is making it so hard and difficult. A system that does not understand lived experience, does not understand peer work at all, has done nothing to understand it. We have teachers who don't have a lived experience teaching this. They don't have any industry experience teaching this. This is not fair. This is not on. So we, together as a team, have been working this pilot project, and we have one hell of a report that's coming your way. So check out our website. Please have a read. Got some wonderful stats there on what we've been doing. And thank you.
Oh,
We'll
great.
open to questions.
Thanks so much, Amanda. Thank you, Simon. Thanks, Michael. So yes, you can see in the workbook there's 2 pages there with some of the preliminary results. And when are you expecting the report to be finalised, Amanda?
It will be December.
December.
Yeah.
So you'll find it for members in our newsletters. We'll no doubt have a write-up and a link, but it will be on our website, which will hopefully be quite easy for you to find as well. Ivan, I go to you.
What can I say? I think that's what's required. People are making clear statements, which I think gives us all of the discussion for me this afternoon, gives a level of detail around how we can tackle and take forward the workforce issues in a much more informed way than what you will see in national strategies or state strategies, which talk about the standard ways we try and attract, recruit and train. This gives, I think, phenomenal opportunity, both from a peer, but also more broadly, how we can do things differently to achieve the outcome that we all need is about increasing our workforce, keeping our workforce, making sure that our workforce is trained and able to do the job that we employ them to do. So I think this, and again, the discussion next week will also similarly do this, is about can we do things differently rather than actual fact just the standard approaches that we have. And we saw that from New Zealand. We've heard that, this afternoon. We've heard that from a whole range of ways that we can do things differently and that this can have an impact short-term to medium-term rather than just all the things that we talk about, which will take 3, 5, 10 years for us to achieve. The only bit that I sort of, as I think, is there a risk about fragmentation of the different sort of sections of the workforce, or should we really be looking at the workforce in total? I think there's pros and cons, but I think we've got to think about to make sure that I'll be blunt, the main game, which is the clinical workforce, etc., doesn't run away with this, rather than that we look at the workforce as a total. I think that's probably it. But still having enough opportunity to look at different workforces, depending on the need, because there's always this tension around we know what's best and we'll take it forward.
We are coming to the end of this afternoon's summit. So I guess I'll just ask for final comments on that from Viv and David.
Look, I think it was a great project that absolutely the work needed to be done. I think anyone who has been working in the lived experience sector for, the last 5, 8, 10 years, particularly recruiting, training, supporting a lived experience workforce, knew of the significant issues that were involved with this qualification, but didn't really have anything to back it up. It was all kind of anecdotally what we heard on the ground, what we were seeing on the ground, the people who we were recruiting, et cetera, et cetera. So I think this project's been an excellent opportunity to actually identify what some of those critical issues are. And hopefully, I haven't read it, but I'm hoping that there's actually some recommendations going forward as well about how we continue to progress and have some quality assurance around this qualification. So thank you, Amanda, for getting up and standing up and saying it, as it's not always easy being the person with the hot poker, kind of poking the bear, but I think it needs to be said. So thank you.
Thank you.
You did it beautifully. David?
Look, yeah, thanks for what you said. I'll just obviously reflect on your comments on the vet sector. You're not imagining it. Yep, that's right. It's
It's a maze.
Yeah, it can be quite the maze at times. Yeah, and it's it's grown and grown and grown, and the attempts to standardise and all those sorts of things sometimes miss the mark and create human collateral damage, unfortunately, at times. And I think it comes down to the the support you provide, having people actually will support people through programs, so identifying the barriers up front, being assertive about dealing with them, but also having, practical supports involved that actually can help people navigate those things is easy. Just thinking someone will start and then be able to finish, I think the other thing too that you mentioned is that the qualification's out of date. I think in the context of the development of training packages, if you're looking at a training package that has its qualification code ending in 1.5 or anything earlier than that, then it's probably a little bit out of date. And I think if you're talking about mental health and you're talking about a training package that was written prior to COVID, then you might be a little out of date. I've got this idea that one day when I find 5 minutes between midnight and 3, I might write a training package around digital engagement, how we actually do counselling and engagement online and using Zoom as a means of doing that. The fact that that's not anywhere in any of our training packages, by 2022, to me, that's a gap. One of the things, and I'm always going to say this because I'm, an educator, would be, I like the idea if somebody does a Cert 4, I love it when they say, what next? Because my view would be, use the Cert 4 to go to the Diploma of Community Services where you can actually access credit into bachelor's programs and get time off of a bachelor's degree. And there's 8 core units, but there's 8 elective units, and there may be credit that comes out of this. And there's ways to actually turn the Diploma of Community Services into the Diploma of Community Services a la mental health. And it can be done with, those sorts of units that, sort of meet the needs of the work. But of course, then having reached that AQF5 Diploma of Community Services, there's then plenty of pathways into university for those who want to take that. And, you heard me give the stats before on high school completions and completion rates. If the pathway to uni traditionally has been via the completion of grade 12 and we're at 56%, then there's another path, and it's this 4 diploma bachelor's. Yeah.
Thank you. Thanks so much, Amanda.
Thank you.
It's been a real pleasure working with you as well this past year, Amanda. Going to ask Jennifer to come up now and just give us what she's heard. I've heard ambition, optimism, available funding, and it can be done. So, I think that's pretty good.
Look, I've got no time to do that.
You do. Go for it.
It's 3 o'clock. I did actually just want to thank our speakers. Wanted to thank Sarah for setting the scene and talking about our bold plan for the next year. Brett for stepping in and talking about the government's plan. I feel we might be good friends from here. I think there was some really important conversation about the lived experience workforce and what we might need to do to bridge the gap culturally and the pay of the lived experience workforce, and to ensure that it's valued, supported and sustainable into the future. Andy, I love Andy's energy. It was great to see some examples of things already happening that we might be able to tap into and move forward with. The apprenticeship program, I think it's got some legs, so we might have further conversations about that. The micro-credential, we've already been through that. It looks like a really good opportunity to get some core skills into strategic places, whether they be onboarding or somewhere else in the system, to help build our workforce. And of course, our lived experience workforce within the Alliance, Amanda, Michael and Simon, thank you so much for your work. And I haven't seen the report yet either, but what I do know is the feedback from the students was exceptional. So thank you and well done.
You're happy?
And thank you to our panel members for, what's the word?
The wisdom holders.
Wisdom holders.
Yes.
I think that's been really valuable to reflect.
It was a term coined this morning by one of our speakers for the over 40 sector. Part of I'm embracing it, wisdom holder. Yeah.
Sounds good. Thank you so much. And it was a really lovely way to reflect on each of the speakers and to explore the subject. So thank you for that.